here on Lagos Traffic Radio 96.1 FM. But of course, traffic reportage right here at Lagos Traffic Radio is our core mandate. So I'm going to be just doing a bit of a diversion slightly to talk to LASHMA PRO for a quick bit of information that he has for us. Hello.
Yeah, good morning, Mike. How are you?
This is Akan, but you can go on, sir.
Akan, sorry.
Yes.
Yeah, good morning. How are you?
I'm very well, thank you.
Just a quick update on the upturned gas truck.
Okay.
Chisco by traffic lighting ward Victoria Island.
Right.
I want to inform motorists flying that taxis that any moment from now, the entire main carriageway will be closed for traffic.
Right.
This is to allow a full recovery process of the upturned gas tanker.
Okay.
And in order to avert any secondary emergency, we have to close that main carriageway any moment from now. I was told the crane has just arrived at the scene of the accident now.
Okay.
So motorists are advised to exercise patience because once the entire main carriageway is closed, then you could imagine the kind of the traffic at this early morning.
Yes.
But we don't have any option that they close it to allow a full recovery process.
Right.
And once that is completed, motorists will be immediately updated as well. Thank you very much.
Thank you very much. The voice of Adebayo Taufik, LASHMA PRO, talking about traffic diversion notice, ongoing recovery of that upturned gas tanker, earlier reported that's inwards Victoria Island. So motorists plying that Chisco axis before the traffic lighting was Victoria Island. Please take note that the LASHMA traffic managers and other emergency responders have commenced the recovery process of the upturned gas tanker that was involved in the earlier accident along that route. In view of this, the entire main carriageway will temporarily closed to traffic to allow for professional recovery of that gas tanker and to prevent any other incidents that might occur due to carelessness during the process. So please exercise patience, please, as much as possible. Let's cooperate with the traffic managers and other emergency responders on ground as efforts are in top gear, to bring things back to normal within the shortest possible time. Of course, the safety of all road users remains the utmost priority of Lagos State government. We'll give more updates on this. Thank you very much for your cooperation. And straight to the meat of today's matter. Of course, I have a guest in the studio. As always, we'll be discussing on, we'll be talking about ILERA EKO, everything about ILERA EKO. But of course, we'll have a key focus today, which I am very, very sure if you give me your attention will definitely benefit you. You will agree with me that as we navigate the complexities of modern life, prioritizing our health should be top on our list of priorities, core priorities, because of course the truth is you cannot be at you cannot maximize your full potentials if you are not in tip-top shape, if you're not healthy, or if any of your loved ones is not fine. You definitely will be affected. Health is wealth, as the saying goes. But think about this. What does this really mean to you, for your family? And that's why, of course, the Lagos State government introduced ILERA EKO, a social health insurance scheme designed to provide quality health care to all Lagosians at very, very, very reasonable cost, which everybody can afford, I tell you. And of course, we know that standard JARA plan is the main plan, that of course that it's I don't want to say it's the basic plan, but it has everything. Okay, it's a plan that it was brought up, it came about after a series of testing and everything, feedback, and from the earlier models, I would say the standard plan and all that. So at this point in time, we'll be placing our focus on that discussion, but we'll do a quick segue. We have a radio drama series, of course. We've been listening to this I think in the last quarter, yes, but we're bringing it back again, just for more to shine more, to illuminate, so to say, this particular point of discussion. So I'm going to be introducing my guest just after we listen to our radio drama series. Stay close. Of course, more traffic updates coming in.
My people for Lagos, the Lagos State Health Management Agency, LASHMA, now them bring this Obunga drama como to this title now, mandatory health insurance.
ILERA EKO, Lawale, ILERA EKO, Noche Walojo, let us work.
rub wire for ground o.
E no possible.
I dey here for am.
No mind that, no. Na so you go dey make mouth. No worry. I go still give you.
Now wow. So una no get any better thing. Shine and your face show.
Wow.
Abeg, where you dey go?
I wan run reach one final burial ceremony. Samsa. Samsa. As you embark yourself for a time like this, now you be the MC? Not be MC, I be the singer. Madam Sansai, I beg come from. Hey, say, you self don't register for ILERA.
Abeg, leave me. I no dey for that kind thing, eh? See, if I sick, I know wetin I dey drink, and when I drink am, I go dey alright.
So upon all the thing wey we don yarn for meeting,
I say I no do na by force.
Not be by force, but e dey compulsory.
Compulsory say wetin?
Na so I hear am say e dey compulsory for everybody wey dey live inside Lagos State.
Okay, come take rope, drag me go register now. If I pay now and I not sick, abeg, now who go give me my money back?
Shine, nobody dey take rope drag anybody. If you no sick, your family fit sick. No mind now, this month alone, you don talk about malaria more than 3 times.
Malaria catch me, but I know wetin I dey drink and I dey alright. Madam Shine, we dey talk of ILERA EKO. You see they tell me say you don't drink when you need. Abeg, leave me. I say I no do, not by force.
Yes, because na the law.
Yes, so na the law make everybody wey dey live for Lagos register for ILERA EKO because our governor, Mr. Babajide Sanwo-Olu, talk am say health na wealth. Na make the Lagos State House of Assembly stamp am and make am to be the law and therefore compulsory for everybody wey dey live for Lagos State to register for ILERA EKO. With ILERA EKO standard JARA, you go get access to good health care for chicken money, no more running katakata or beggy for money to treat yourself or family when you sick. Just carry yourself go hospital, make them take care of you with the correct medicine free of charge. Our governor for Lagos want all of us for Lagos today can't pay na law, and so therefore it is compulsory for una to register for ILERA EKO because sickness you know they knock you before you enter.
Me I no know say now waiting gets benefits like this so.
Now why you say make we dey enlighten ourselves be that not be everything be cho.
Come. Now who they do cho? Take your time
I just dey talk my own, I no talk to anybody.
I beg better person, Sam. See, first thing tomorrow morning, I go register for ILERA EKO.
Me, I no be better person. Daniel, James, una two self join. Only me dey free.
You get to head.
I don't register for one with one private company.
I hear say you follow.
Yes, as long as they live for Lagos State, you must register for ILERA EKO and get your own policy number.
I even hear say if person no register, he no go enjoy the wonderful things when the State government dey do.
Correct. Papa Joe, point of correction. That way you talk, I no be stranger for Lagos. I be real Lagos boy. When they show good example by following the law.
Sorry, Omonile.
Correct Lagos boy.
For better informative, carry waka come our head office for Good Shepherd House, opposite Secretariat Alausa Ikeja, or call this number there 0800 ask LASHMA. That na 0800 2755 27462 or 0916 9185 920 or WhatsApp for 0704 535 8275. ILERA EKO, it don't leave anybody behind.
ILERA EKO, la wale. ILERA EKO, no chewalogo. Let us work hand in hand. Lagos health is our way. ILERA EKO, la wale. ILERA EKO, no chewalogo. Let us work hand in hand. Lagos health is our way.
right, welcome back. Quite an interesting episode. Of course, with this, I'm sure you've learned a lot. With us in the studio, to talk more about this, we have Miss Ijoma Ekeowa. I hope I pronounced that correctly. She is a sales officer with the Lagos State Health Management Agency. You're welcome, Miss Ekeowa.
Thank you very much.
All right. And how was traffic coming in for you today?
No, anyway, the traffic is a bit light.
A bit light coming from your end.
Yes, yeah,
okay.
A bit light.
Yeah, great to have you with us. And of course, I'm sure we're going to have a very, very fruitful discourse today for the benefit of the entirety of Lagos residents. Of course, I know there are people who might not really know what this is all about. We've listened to the radio drama series, so I think we now all have an idea. But let's talk about the standard JARA plan, which of course is the point of our discussion today. So for the benefit of everyone who and those who perhaps might not really have a full grasp of this, what exactly is the ILERA EKO standard JARA plan?
Okay, thank you very much for that question. ILERA EKO standard JARA plan.
Yes.
Let me just define what ILERA EKO is. Yes. So from there we can have an insight about the standard JARA. So ILERA EKO is the mandatory social health plan that was established by law in 2015 and became fully operational in 2020. So it's for everyone that resides, or you own a business, or you work in Lagos State, to have this mandatory health care. So from there, from the ILERA EKO, we have different plans, which we'll be talking about one of them, which is the standard JARA plan. So the standard JARA plan is our first, or will I even say is one of our plans that we operate with. So it's the most affordable plan in our three plans that we have. So a lot of people use standard JARA as will I say, let me try this plan. Their normal English, yes. So it's part of our plan as well that we operate with.
All right. And of course, we're aware of the fact that prior to this time, we had earlier versions of a plan. What necessitated, LASHMA coming up with this new improved plan?
Oh, okay. Initially, we used to have the other plan before we...
Standard plan, standard. We had the standard plus then.
Exactly. We have the standard plan and the standard plus plan. So now we realized that the standard plan was not doing exactly what we wanted. So we now increase it to the standard, exactly, due to feedback and complaints. So we now move to standard JARA plan, which is giving our enrollees the benefits that they want. Exactly. So it's more advanced than the previous standard plan.
All right. If you say it's more advanced, so that means that there's like more benefits. Is that what you mean?
Yes, there are more benefits attached to it. Exactly. Yes.
Okay, so let's talk a bit about the benefits. What do I stand to benefit coming on board? That if I'm not already on the ILERA EKO standard JARA plan, what do I stand to benefit?
Okay, part of the things you stand to benefit under this standard JARA plan that was not in the initial one. Part of it is the consultation, and we have the specialist consultation.
Consultation.
Yes, specialist consultation, yes, which is 5 seasons in a year.
Okay, 5 sessions.
Yes, and it should be indicated by the doctor.
Okay.
Yes, you don't just
you can't just go
exactly
by yourself,
and say, I want this consultation. You have to make payment. So the doctor have to ask for it and ask you to do it. So aside from that, we equally have the eye clinic, the eye care. The eye care, which you have access to glasses.
Yes.
Glasses for 10,000 naira.
10,000, okay.
Yes, glasses for 10,000 naira, and you have access to operate one of your eye in a year.
In a year.
Yes, just one eye.
That's for like cataract surgery.
Cataract surgery, exactly. Okay. Yes. So then we move on to the family planning, the hospital care admission, which is for 15 days in a year, accumulatively. You know. So, and we have the pharmaceutical care, whereby you can go to any pharmacy around your vicinity. That's we call it a community pharmacy. Okay. Yes. So you walk into the pharmacy and pick your drugs. Meanwhile, before going there, the hospital will have to give you a code. Okay. They're gonna give you a code that you take to the hospital, the pharmacy.
That's your prescription.
Your prescription, exactly. So without that code, the pharmacist won't disburse the drugs to you. So with the code, that's where you have access to the drugs.
And this will guard against, abuse and all that.
Exactly. Yes. Yes. So you just walk into the pharmaceutical store and pick your drugs from there. Okay. So furthermore, we equally have the delivery. Okay. Yes, the delivery care. Okay. You have the delivery care and all of that, So, and let me not waste much of our time. We have the VBUT. Okay. We have the VBUT, the telemedicine that was not included in the previous plan.
Right.
So yes. So with this, if you are under the standard JARA, you have access to all of this.
All of this.
Yes.
Okay. So last week we had a question that I want to tie into today's edition of the show. Someone sent a message on WhatsApp and was asking if fibroid surgery is covered. Fibroid surgery. In fact, we had two questions actually. The other one came in at the end of the show. So let's talk about that. Is fibroid surgery covered under a standard JARA plan?
No.
No.
It's not covered.
Okay.
However, the admission, we cover admission. That's 15 days.
The admission.
Yes.
Okay.
So now the admission is covered.
Okay.
And we offer 2 pints of blood.
So during the surgery, you have it. That is covered.
That is covered.
Okay, but I don't know. I feel LASHMA should look into that. They should come up with a plan that has coverage for that. Since other surgeries, there are other surgeries covered.
Yes.
You talked about the eye. How about hernia and other surgeries?
Eye is covered.
Okay.
Appendix is covered.
Appendicitis is covered. Yes. Okay. Okay.
And you anyway, all of those things are covered.
All of the things are covered. Okay. So at the end of the show, we also had someone reach out and was asking. She actually was complaining that she went to the hospital. She's on the standard JARA plan, and I think she wanted to do birth control, and they said it's not covered.
Birth control.
Yes, that's family planning. Yes,
it's covered.
Okay. She said when she went to, she was told that it's not covered.
Okay, in such situations, please, we should call our contact center.
Okay.
Yes, when this particular thing is covered, why are they not giving me access to it? The only thing you need to do before leaving the hospital, you just have to call our contact center.
Okay.
For you to have access to that.
Right.
So the contact center is going to speak to the doctor or the nurse on it.
Yes.
Available there.
All right.
Then they will do the needful.
Okay, so can we just get those numbers as we're talking about it? Yes. So let's just get those
our
numbers.
contact center number is 0800 275 52 74 62. Yes. So the second one.
Yeah.
We have the 0800 453 72 356. Yes, or you call 0700 yes.
Okay.
45 372 356. Yes.
Okay, those are the numbers we can call. And of course, when in such an instance, like how soon would the person get feedback?
Immediately. Yes, because our contact center is 24/7.
Hours.
24 hours.
So immediately such happens, the person should call immediately. You can call at the scene where it happened at the hospital.
Exactly,
and they would give a response immediately. Okay.
Yes.
And okay, so now talking about standard JARA plan, talking about ILERA EKO, we also get this question a lot, so I'd like us to just clear the air. Who are those that are eligible to register and enroll on ILERA EKO on standard JARA plan? Who are those?
Okay, that's a very wonderful question.
Yes.
It's not limited to anyone.
Okay.
Yes, it's for everyone that resides,
okay,
that own a business, or even work in Lagos State. So
because we have people stay on the fringes of Lagos. We have people stay in border towns and all that, and they tune in on this frequency and they hear this and they ask the question that I want to come on board, but of course, you when we say it's for those in Lagos, it's in fact, as the name implies, ECO. Some people just want to know if
it's ECO.
Yeah.
Yes, it's for ECO. It's for everyone that resides in Lagos State. Okay, so we have a lot of people that work in Lagos State, like a lot of companies that we go to speak to them, and they be like, but I don't reside in Lagos. How do we do it?
Okay.
So places like Songo,
yes,
you want to join the scheme, you can actually go access the scheme, but just that the hospital you'll be using will be a hospital that is in Lagos State. So we have hospitals that are close to Songo, like hospitals in Alakoko.
Yeah, thereabouts.
Yes. So you can choose from there and start accessing care.
Okay. So now a lot of our attention is on the standard JARA plan. Of course, I know that beyond that there are other plans.
Yes.
So can we talk a bit about the other plans, or is that the only plan that we have?
No. We have other plans.
Okay.
And one of them is the standard JARA Plus plan.
Standard JARA Plus.
Yes.
So there's a plus on the standard JARA. Okay.
Exactly.
Okay.
So for this standard JARA Plus plan, I'm going to be telling you the prices.
Yes.
So the for the annual premium, for an individual is 40,000 naira.
40,000 naira.
Yeah. So for a family of 4, which is the principal and the spouse.
Yes.
Then 2 children that are below 23 years of age is 40,000 naira.
Okay.
I'm sorry, 146,000 naira.
Okay.
Yeah. So for family of 6 is 220,000 naira.
Okay.
So we equally have the seniors plan,
right,
which is for those that are 60 and above. 60 and above. So for an individual is 60,000 naira.
60.
So for a couple is 100,000 naira for a year.
Right. Okay. So where if it's just grandma, it's 60, but if grandma and grandpa, there's a sort of discount.
Yes.
Okay. Great. And well, let's quickly check out what the traffic situation is looking like at this time. Let's see if we can just take 1 or 2 updates. All right, just before we take that update, I seem to have a call. Hello, good morning.
Good morning.
Yes, good morning. Who do I have on the line, please?
This is Citizen Gabriel.
Okay, please go on, Citizen Gabriel.
Yes, I've been listening to you last week. I listened to you today again.
Right, sir.
I want to know, is it the hospital that ILERA EKO uses? Is it the general hospital or private hospital?
Okay, the hospital they use, is it general or private hospital? Okay, thank you very much.
Sir.
Yes, sir.
Hello?
Yes, if I get you correctly.
The number you called, you should call it slowly so that we can be able
to get it. Okay, thank you very much for calling. Do enjoy your day. Just listen over the radio and you'll get all the information. Thank you so much. All right, 080-991 20777. Of course, the calls can start coming in. That's also our WhatsApp line, 080-991-20777. Hope you got his question. Yeah, he wants to know about the hospitals. So, choice of hospitals. Is it only general hospital? Is it only government hospitals? And are private hospitals also part of this? And then what's the next question? He wants to know. He wants the numbers that he can call or reach out to. So you have to take them again, but slower. So that yes. So my dear listener, if you're out there, just get your pens and of course we'll reel out the numbers slowly. Okay,
so firstly I'm going to answer the first question, which is it only general hospital we operate with? No.
Yes.
We equally operate with the private hospitals.
Okay.
We operate with the primary health care center as well. So is either you choose private, general or primary health center.
Okay.
So it's your choice. So as
all
long
right,
as
I have another call. Yes. So, hello, good morning.
Hello, good morning.
Yes. Who do I have on the line?
My name is Dave.
Okay. Please go on. Yeah. Yes, I can.
Sorry, she was talking about people that are not in Lagos. I
Yes.
have another that is not in Lagos.
Okay.
That can she do the plan?
That says in where? That says where?
She says on
Ondo.
Can she do it?
No, I don't think she can't. I don't think she can. Ondo is a bit far. It's quite a bit of a distance.
When she comes to
when she comes to Lagos, okay. And she stays with you, right? When she comes.
Yeah, when she comes.
Yeah. Okay. That's okay. Just listen over the radio. My guest will respond. Thank you so much for calling, Gift. Okay. Could you also respond to that too?
Okay, so as I was saying earlier on,
yes.
Okay, we have different hospitals. We have a lot of hospitals in different local governments. So you can just choose any of your choices there. We have list of them. Okay, so the second question again is, can you please remind me?
The numbers.
Okay, the numbers to call.
Yes.
The numbers to call in the hospital. Okay. 0800
0800
45 372 356. I'll come again.
Okay.
0800 45 372 356. Yes. So the second number is 0700 45 372 356. Yes.
Okay. How about this other question by Gift, who wants to know if when her mom comes, she can always access care?
Of course, can always access care if she comes around. She can always access care. So as long as our policy is active within the period of time she comes around. And she should ensure that she renews her policy anytime it expires. Because there's a penalty to it.
Okay, so I have a question on WhatsApp. I wish to know what one can do in a case of some hospitals where their front desk officers do not come on weekends and one cannot access services. This person did not put his or her name, but of course we can just attend to this question straight away. So what happens in such an instance?
Okay, in most cases you just need to call our contact center, and once they know you are under the ILERA EKO, you don't need any front desk person to give you approval before you see the doctor. And if they refuse you to see the doctor, you can always call our contact center, and you have access to care.
Okay. So I think that's so. Any of those numbers you gave us?
Yes.
All right. That's a good one. Okay, so thank you. And my dear listeners, you can still call in. 00991207777 and 09153877127. All right. This update is from the Iba Auto Ijaniki axis. The earlier reported impediment at ECC gate, main carriageway North Barracks along Badagry Expressway, has been moved away from that end. So of course, if you are in that axis, if you're around there, do take note that of course that has been moved, so you can resume movement. Normalcy will return on that stretch. Yes, so we still have our guest with us, Ms. Ijoma Ekeowa, sales officer with LASHMA, and we've been talking about the standard JARA plan and what the benefits are, how you can be a part of this, and what you get to enjoy. And okay, so what are the premiums for the plans, and does any of the packages, does any of them have any limitations? Let's put it that way. And from there, let's just talk about the process of registration and how people can come on board. So what are the premiums?
All right. The peculiarity between the standard JARA, standard JARA plus plan and the seniors plan is one, the standard JARA comes with a co-payment plan. Like, you make payments in the hospital in some of our services, but the standard JARA plus plan does not have a co-payment plan. Yes, one of the things that you need to make payments under the standard JARA is I'm going to be telling you the terms and conditions that are attached to it.
Please go on.
So to assess the maternal care and the surgeries. So now it has to be you have to pay a full premium plan, full premium payment.
Okay.
A full premium, yes.
Okay.
Yes. So for the general body checkup,
yes,
it has to be from the second renewed annual payment.
Okay.
That is when you can have access to it.
So you must have done an entire year.
Exactly.
Okay.
Before you can have access to it.
Okay.
So now, what else? Okay, now, so the additional payment dependence.
Yes.
That is above 23 years.
Yes.
Is 15,000 naira.
Right.
Yes. And any payment that is not made before 25th of that month cannot access care from the following month.
Okay.
You understand? Yes.
So any payment beyond 25th,
yes,
you'd wait for an entire month before you can access care.
Yes. Yes.
Right.
So, furthermore, failure to renew your premium within 3 months of expiration,
yes,
will attract a penalty before payment of the new premium is made.
Okay.
Yes.
Okay, so registration, what's the process of registration and how can we enroll? Let's just talk about that. Yes.
Process of registration.
Yes.
You can register online.
Online, okay.
Yes, through our website.
Okay.
You can register coming to our head office.
Yes.
At Alausage at the Good Shepherd House.
Okay.
Opposite Secretariat bus stop.
Yes.
You can just walk into our office and register there, or you visit any of our 5 PBLs offices.
The local government.
Yes, the local governments.
Okay.
Which is the Ikeja local government, the Badagry and the Ikorodu and Lagos Island and Ekpe.
Okay. So please, can we clearly state out what's the premiums or how much are we paying for the standard JARA plan, for the individual, for the family? Let's just talk about that real quick.
Okay.
I know. Yeah.
For the individual is 15,000 naira.
15,000 naira. Okay.
Yes. For a family of 4.
4.
Which is the principal and spouse with 2 children below 23 years of age.
Yes.
Is 55,000 naira. 55.
Okay.
Yes. So for family of 6 is 80,000 naira.
80,000 naira.
Yes.
Okay.
So the family of 6 consists of father, mother, and 4 children.
4 children.
Yes, below 23 years of age.
But we also have family sizes bigger than that. What happens?
That is where if the individual, the additional dependent is above 23 years, is 15,000.
Okay.
And if the person is below 23 years, is 10,000 naira.
All right.
Yes.
Okay, so before I let you go, what is your final advice to Lagos residents on ILERA EKO?
Okay, before I give my final advice.
Yes.
Your registration points can still be me.
Okay.
Yes, so you can call me on this number.
Let's have your number. Yes.
Yes, 081 66 70 67 81. I repeat, 081 66 70 67 81. So you can always call me for your registration. I will register both companies. We go to churches, we go to works, we go to associations.
Okay, some people might want you to come and give a talk. So let's just have your number again, but take it a little slower.
Okay, 081 66
66
70 67 81
81
081 66 70 67 81. Yes.
All right. Thank you so much. So let's just have your final advice to Lagos residents.
Okay. Please, like the popular saying that says, health is what is wealth. Please, let's take care of our health by registering under the Lagos State Health Scheme, the ILERA EKO. It's very affordable, and it equally comes with a quality healthcare. So please register with us and stay safe. Thank you.
All right. Thank you very much. We have come to the end of today's episode of ILERA EKO Extra. Remember, your health is your wealth. Investing in your health is investing in your future. Don't wait until it's too late. Enroll on ILERA EKO today and secure healthier tomorrow for yourself and your loved ones. Visit the LASHMA website if you need any of any information, or visit any of our enrollment centers. So the LASHMA website is www.lashma.com. You can learn more. You can also call any of the hotlines we reeled out earlier for assistance. A big thank you to Adinka Bimbade, Assistant Director, Public Affairs, LASHMA, for her support and collaboration in bringing this episode to life. Also a big thank you, to Alima right here in the studio, pulling the strings from behind. Also a big thank you Thank you. Yes, big ups to, of course, PS. Yes, Dr. Manuela Zamba. Yes, and to you out there, thank you for always, tuning in on the show, ILERA EKO Extra on Lagos Traffic Radio 96.1 FM. My name is Akan Usen saying, stay healthy, stay informed, and bye for now.